Many men that seek a penile prosthesis as a solution for their sexual dysfunction only have erectile dysfunction, while others not only have ED, but also another condition called Peyronie's disease. Even though in some occasions the inflatable penile implant is strong enough to straighten a curvature, there are some situations in which other surgical techniques need to be performed in conjunction with the penile implant in order to address a deformity. What are those techniques? What are the risks? Which implant is best for Peyronie's disease? Let's talk about it. Hello, my name is Jonathan Clavell, urologist and men's sexual health expert and penile implant specialist in Houston, Texas. If you are considering a penile prosthesis for the management of combined ED and Peyronie's disease, there are things that you must understand. Peyronie's is a condition that affects many men, but unfortunately, they do not talk about it openly. Today, I want to explain how a penile prosthesis can both restore sexual function and also correct curvature. We will also talk about why the surgery might be the right solution for men with both erectile dysfunction and Peyronie's disease. First, let's talk briefly about what is Peyronie's disease. Peyronie's is a medical condition in which a penis forms scar tissue, which we call a plaque. And this plaque develops as a result of some form of either microtrauma or injury. When a penis undergoes microtrauma during sexual intercourse, the body will try to heal it, and sometimes instead of bringing healthy, elastic tissue to heal, the body brings collagen or scar tissue, which is not elastic. This inelastic scar tissue may cause the penis to bend, curve, or form a deformity during the erection state. In many cases, that curvature or the deformity can be severe enough to interfere with sexual function. And given the fact that the penis is a cylindrical structure, depending on where that scar tissue is located, the penis can take different types of curvature and or shapes. The penis, for example, can bend up, it can bend it to the side, it can bend down, it can form an S shape, it can shrink because the scar does not allow it to expand, it can form an hourglass deformity or sometimes the form of a bottleneck. It all depends on where in the penis the injury occurred and where the scar tissue or plaque develops. Many men with Peyronie's can also develop erectile dysfunction. Sometimes the plaque can prevent proper blood flow to get to the penis or distort the internal structure of that penis that keeps the blood trapped inside. That's right. Sometimes ED can lead to Peyronie's and sometimes Peyronie's can lead to ED. These are two conditions that commonly show up together. Now, there are several things that any man with the curvature needs to understand. Number one, not all curvatures are Peyronie's disease. Many men, and I would even be tempted to say that most men, have some degree of curvature in their penis. That is, being straight like an arrow is rare. A curvature that happens during puberty or one that you were born with is considered a congenital curvature. A congenital curvature has a very different pathophysiology or disease process than a curvature that occurred secondary to Peyronie's. Congenital is one that you were born with. Peyronie's is an acquired curvature. Acquired means that this is not something that you were born with, but rather something that occurred later in life. Congenital curvatures rarely have a palpable plaque and rarely are associated with erectile dysfunction. Number two, we only treat Peyronie's disease depending on two things: the degree of erectile function and the degree of bother. If a man has good erectile function and the curvature does not bother him or his partner, I would truly discourage them from getting it treated. However, if the curvature is bothersome or if a man has a deformity and erectile dysfunction that does not respond to medications, we can certainly offer a treatment for them. Number three, if a man has good erectile function and Peyronie's disease, there are other options for them that do not require a penile prosthesis. However, there are very few instances in which the severity of the curvature is so significant that a surgeon might recommend the use of a penile prosthesis in order to address both the curvature and ED, or at least minimize the risk of developing erectile dysfunction in the future. This is something that a patient should discuss with their surgeon, and if you are unsure or something does not sound right, you need to remember that you always have the right to seek a second opinion with a urologist who specializes in Peyronie's disease. Now, regardless of which one came in first, the chicken or the egg, that is ED or Peyronie's, there is one solution that can address both conditions, and that is a penile prosthesis. Does this mean that everyone who has Peyronie's needs an implant? Absolutely not. There are many men that either have good erectile function or have a curvature that is not considered severe or complex that may benefit from less invasive treatment options like injections, traction therapy, or less invasive surgeries. This is something that you should always discuss with your surgeon. And what is a penile prosthesis? A penile prosthesis or a penile implant is a medical device that is placed inside the penis during a surgical procedure. The most common type we use and the one that we recommend the most for men with Peyronie's disease is the inflatable penile prosthesis. The inflatable prosthesis is generally stronger than the malleable prosthesis as it provides for better axial rigidity to the penis. The term axial rigidity in the context of a penile implant refers to the stiffness and the resistance of that implant to bending along its length when subjected to pressure such as that produced by penetration. In practical terms, it is a measure of how well the prosthesis can withstand compressive or bending forces without buckling, which is essential for allowing effective and satisfying sexual intercourse. The inflatable penile prosthesis allows for good axial rigidity, which ensures that the implant maintains the penis both straight and with a firm shape when inflated. Now, when would a doctor consider a penile implant for a man with Peyronie's disease? There are 3 scenarios in which a doctor might consider a penile prosthesis for Peyronie's disease. Number 1, when there is presence of both Peyronie's disease and erectile dysfunction. When a man has a bothersome deformity or curvature and erectile dysfunction that is not responding adequately to medications, the only treatment option that will help with both is a penile implant. Think about it. If we improve the curvature, but the man still has significant erectile dysfunction, we really didn't solve anything. That man will very likely still be unable to engage in successful sexual intercourse. Therefore, if a man has both a bothersome deformity and erectile dysfunction that does not respond to medications, he is a perfect candidate for a penile implant. The second scenario in which we consider an implant in the setting of Peyronie's is when a patient with decent erectile function has severe deformity that would require plaque incision and grafting, but the risk of erectile dysfunction after the surgery would be so high that we might suggest an inflatable penile implant to mitigate that risk of erectile dysfunction. When a man has a severe curvature or deformity, if we do plaque incision and grafting, the risk of developing erectile dysfunction can range up to 30 to 50%. Therefore, placing an implant will definitely make sense in order for us to be able to correct the curvature adequately without worrying that the patient will then develop any erectile dysfunction that will not respond to medications. And the third scenario in which we consider a penile prosthesis in the setting of Peyronie's disease is when a curvature comes along with what we consider a hinge effect. There are some men with Peyronie's that feel that their erections are unstable or not strong enough for penetration beyond the point of curvature or deformity. That is, you feel that the base of the penis is strong, but beyond the curvature or deformity, the erectile rigidity feels weaker, unstable, or it buckles during sexual intercourse. In this scenario, the only way that we will be able to provide stability to the penis, in my personal opinion, will be with the penile prosthesis. However, patients should always discuss with their specific surgeon as each and every case is different and treatment should always be tailored to each individual patient. Now, you might wonder, how can an implant help with curvature? Well, the penile prosthesis gives the penis the actual rigidity that it requires for it to resist the pressure from sexual intercourse. Peyronie's disease occurs at the level of the tunica albuginea, which is the strong elastic layer that surrounds the corpora cavernosa. The penile implant occupies a space inside the corpora cavernosa, and once inflated, these cylinders both expand to stretch the tunica albuginea and have the strength and pressure to help straighten the tunica albuginea. Yes, there are some instances in which placing an inflatable penile prosthesis alone without doing any additional maneuvers will help straighten a penis that has been affected by Peyronie's disease. However, this depends on several factors, including the severity of the curvature and how calcified the plaque is. What I mean by this is that there are some men that have plaques that are stronger than others. For example, some men have a plaque that feels like a piece of rubber, while others have a calcified plaque that feels like a small piece of a rock or a bone. If a man has a softer plaque and mild to moderate curvature, inserting a penile prosthesis alone can help correct the curvature. However, when curvatures are more severe or the plaques are more dense or calcified, your surgeon might recommend doing additional maneuvers to help correct that curvature. There are multiple surgical techniques that can be performed at the time of placement of a penile prosthesis, and in many occasions, it depends on the severity of the curvature and how comfortable your surgeon feels in performing these additional techniques. Let's talk about these techniques. Number 1, Manual modeling. Manual modeling is a technique used during penile prosthesis surgery, specifically in patients with Peyronie disease or congenital curvatures to help correct a curvature that is caused by the fibrotic plaque. This technique is fairly simple and it involves placement of an inflatable prosthesis. We inflate it to the max, and once it is fully inflated, the implant will stretch the tunica albuginea to its maximum potential, and the surgeon will bend the penis in the opposite direction of the curvature. This way, we are applying controlled pressure to stretch or partially break the fibrotic plaque from the inside. This helps to straighten the penis without the need of more invasive procedures. What are the advantages? It is simple and effective for correcting mild to moderate curvatures. Those are curvatures that are typically less than 60 degrees. It can be performed immediately during prosthesis placement, and therefore it avoids the need for additional incisions or instrumentation, which can decrease the risk of complications like infection. Disadvantages: it does not work well for severe curvatures, and it does not address hourglass deformity or narrowing when present. Also, the correction may not be perfect, and some men may remain with mild residual curvature after modeling. And finally, as with any other surgical technique, it requires judgment to avoid complications. What are the risks? There is a small risk of urethral injury, particularly in the distal urethra, which we call the fossa navicularis. How can this happen? Sometimes the force that we are applying to the cylinders is so great that it can cause significant pressure at the weakest area within the tunica albuginea, and that weakest point is at the level of the fossa navicularis. If this were to happen, in some occasions, we need to remove the penile prosthesis and allow your body to heal before we are able to get another implant inside. However, no need to worry since this is extremely rare. Overall, modeling is a commonly used method to optimize both function and penile straightness in a single-stage procedure in men with both ED and Peyronie's. In some occasions, modeling can be combined with another technique called scratch technique to enforce curvature correction. The scratch technique involves making controlled incisions or scratches in the tunica albuginea from within the corporal body over the area of the permanent plaque, using either a scalpel or the tip of a sharp scissors. This can weaken that fibrotic tissue from within and increases the elasticity of the tunica, making modeling more effective. When performed carefully, it can improve straightening results without the need for grafting, especially in patients with more resistant plaques or moderate curvature. It is important to note that the scratch technique can only be performed along with the penile prosthesis. Next in line, plication. Plication is one of the most commonly used techniques to correct penile curvature. Plication involves placing permanent sutures on the convex or longer side of the penis to shorten it and straighten the shaft. Unlike modeling, which attempts to stretch or disrupt the plaque, plication mechanically balances the two sides of the penis. As you can see in this picture, a penis with a curvature has a longer side and has a shorter side. With plication, we are placing sutures to shorten the longer side and therefore allowing the penis to stretch in a uniform and straight fashion. What are the advantages of plication? It is technically straightforward and can be done during the same surgery as implant placement. It is also useful when manual modeling alone does not fully correct the curvature. It does not require an incision into the plaque or graft material. What are the disadvantages? It can lead to loss of penile length on the plicated side, which may be noticeable to some patients. It may also sometimes not be suitable for patients with significant narrowing or hourglass deformities. And in some occasions, it does require careful balance to avoid overcorrection or cylinder buckling. The risk of numbness or nerve injury is also less with this procedure. Overall, plication is typically reserved for patients with good penile length, mild and stable deformities, or mild to moderate curvatures not amenable to correction with modeling alone. It is a reliable option to achieve a straighter result when combined with prosthesis implantation. Men, however, need to understand that in some occasions, this can lead to slight shortening of the penis. How about if I want to get rid of my plaque or I don't want my penis to get any shorter? Here comes plaque incision and grafting procedures. For patients with severe penile curvature, significant hourglass deformity, or a hinge effect, plaque incision and grafting may be necessary during penile prosthesis surgery. This technique involves making an incision into the Peyronie's plaque on the shortened side where the plaque is located to release the tension and allow the shaft to get straighter. In many occasions, however, depending on where the plaque is located, in order to be able to cut that scar tissue, we need to either elevate the nerves that give sensation to the penis or elevate the urethra to avoid injuring them. Look at this image, for example. The nerves that give sensation to the penis are located in a layer just above the tunica albuginea, and the urethra is on the bottom part of the penis. If the patient has a dorsal plaque, which is the top part of the penis and is causing an upward curve, we will need to separate those nerves, which we call the neurovascular bundle, from the plaque in order to make that incision in the plaque. In the same way, if the plaque is on the bottom of the part of the penis, there is a possibility that we will have to dissect and separate the urethra to be able to reach the plaque. Therefore, in order to avoid injuring those nerves, the surgeon must perform a very careful dissection, which most experts and guidelines recommend to only be performed by experienced surgeons. When performing plaque incision and grafting, we are making an incision into the tunica albuginea, which releases the tension caused by the plaque, and this allows it to expand. This will create a defect or a hole in the tunica that sometimes needs to be covered with a graft. A graft, which is usually a biologic or synthetic material, is then placed over the defect in the tunica to prevent herniation of the penile implant, which is the implant from bulging out through that defect, and also maintain penile structure. Advantages of plaque incision and grafting: it allows for correction of severe curvatures, that is, those that are above 60 degrees, and those with complex deformity that cannot be corrected with other less invasive maneuvers. It also helps restore penile length and girth, especially in patients with significant shortening or narrowing. Let me repeat that. Plaque incision and grafting can help restore, not lengthen, but rather restore some of the length previously lost secondary to Peyronie's disease. And this technique can also improve both aesthetic and functional outcomes in appropriately selected patients. And what are the disadvantages? It is a technically more complex procedure which adds more time to the surgery. It can also carry a slightly higher risk of complications like nerve injury, loss of sensation, hematoma or bruising, and delayed healing. In addition to traditional plaque incision and grafting, there are several tunical sparing or tunica expanding techniques that have been developed to address complex penile deformities while minimizing the need for large grafts. For example, the tunica expansion technique and multiple slit technique involve making controlled staggered longitudinal or transverse incisions in the tunica albuginea to relieve curvature and allow the penis to expand symmetrically with the prosthesis. I routinely perform a modification of the multiple slit technique called the SAPOC technique, which stands for slices around the point of maximal curvature. Another technique that is used for patients with hourglass deformity or indentations caused by Peyronie's plaque is called extra-tunical grafting. To understand what this means, we can break those words down. We are placing a graft extra-tunically, meaning outside of the tunica albuginea. With this technique, instead of making an incision to the plaque or the tunica directly, the surgeon places a graft material externally, around that tunica, over the depressed area of the tunica albuginea to provide cosmesis and contour symmetry around the tunica albuginea and the prosthetic cylinders inside. Check it out. Sometimes the penile prosthesis is not strong enough to expand that indentation caused at the level of the tunica, and adding that graft material outside of the indented side makes the penis look more uniform. This technique is particularly helpful in cases where the penis has adequate straightness but shows focal narrowing or poor cosmetic appearance when the implant is inflated. The indentation can be at the base, midway to the shaft, closer to the head of the penis, making it look like the bottleneck of a beer. Advantages of this technique: we avoid incising the tunica albuginea, therefore we can avoid the risk of injury to the neurovascular bundle or cylinder herniation. It is generally a quicker procedure than plaque incision and grafting. It also preserves native tissue and maintains corporal integrity. Disadvantages may include limited correction for curvatures, since we're not doing anything to the curvature with the graft. It may also be less effective if the narrowing is due to deep, rigid plaque. It does require either an additional incision or a longer incision in order to properly accommodate and place the graft. Now, what should I expect after an implant surgery if I have Peyronie's? This all depends on if and which additional technique was utilized to correct the deformity. For example, if a penile prosthesis was placed and no additional maneuvers were performed, recovery will be similar to any other patient who underwent a prosthesis placement. If manual modeling was performed, a man should expect a little bit more bruising than usual. If plication surgery or plaque incision and grafting were performed, sometimes we need to either make an additional incision or extend our incision, and therefore a man should expect more swelling along the penile shaft than usual. However, generally speaking, recovery is still close to 6 weeks, and in some occasions in which aggressive reconstruction was performed, a man can still notice some swelling that can last for a few months. That said, most men are still able to cycle their implant within the first 6 weeks and be able to use it. This truly depends on how you specifically heal. What type of implant should I consider if I have Peyronie's disease? Everyone should know that there are different types and different brands of penile implants. When a man has Peyronie's disease and is considering a penile implant, generally speaking, we prefer to use an inflatable rather than a malleable penile prosthesis. Why is that? Because the inflatable penile prosthesis is generally stronger than the malleable prosthesis. Why not a malleable prosthesis, you might be wondering? We need to understand that a malleable or semi-rigid implant does not expand and therefore does not apply any outward pressure like the inflatable cylinders do. Therefore, malleables can reliably correct curvature or restore length in men with Peyronie's disease. Malleable rods do not expand. They are bendable metal cores that hold the penis in a semi-rigid position. Because they don't create internal pressure, they cannot break or stretch the plaque from the inside. When placing a malleable implant, any residual curvature, generally speaking, remains uncorrected unless you combine the malleable prosthesis with a separate plaque surgery like plication or plaque incision and grafting. But even then, the lack of expansion means less desirable outcomes for length and straightness. Now, why inflatable cylinders are better? The inflatable cylinders, on the other hand, provide for better axial rigidity and excellent tunical expansion. In Peyronie's disease, we want maximum rigidity to help resist 3 things: residual curvature, buckling, and instability during sexual intercourse, specifically if the tunica is scarred and less supportive. There have been research studies comparing the Coloplast Titan with the AMS 700 CX and the LGX cylinders. What were the results? The Coloplast Titan was overall stronger than the AMS cylinders, although only by a slight margin when compared to the CX cylinders, specifically when the penis was shorter. For longer penises, the Titan provided better axial rigidity than the AMS products. So in conclusion, the Coloplast Titan and the AMS 700 CX cylinders are better for men with fibrosis and Peyronie's disease. There should also be a special mention for the Coloplast narrow base cylinders. Each device company has larger diameter cylinders, which are the Titan for the Coloplast company and the CX and LGX cylinders for the AMS 700 or Boston Scientific company. There's also narrower diameter cylinders, which is the narrow base cylinders for Coloplast and the CXR cylinders for the AMS 700 series. Now, the Coloplast narrow cylinders contain the stronger BioFlex coating, provide for slightly better diameter and better expansion in narrower corporas affected by fibrosis and Peyronie's disease. In summary, many men who seek a penile prosthesis do so for erectile dysfunction alone, while others have Peyronie's disease, which adds a whole other layer of complexity. Although an inflatable penile implant can often straighten mild curvatures by itself, more severe or complex cases may require additional surgical techniques like manual modeling, the scratch techniques, plication, plaque incision and grafting, tunical expansion methods, or extra-tunical grafting to fully correct the deformity and restore erectile function. Every situation is different, so it's important to understand your options. Know the risks and benefits and talk openly with an experienced surgeon who specializes in both ED and Peyronie's disease. If you're considering a penile implant to treat both conditions, make sure you're informed, empowered, and confident that you're getting the solution that fits you best. And if you're looking for an expert with vast experience performing these procedures, we are here for you. See you next time.